Okay, so let's talk about hepatic encephalopathy. So hepatic means liver, excuse me, encephalopathy means swelling of the brain. Alright, so to get hepatic encephalopathy, what happens is something is going on in the liver that blood can't get there. So then it just bypasses the liver and continues on in circulation. But what that means is any toxins that the liver was supposed to get out is going to back up into the bloodstream. Alright, once the toxins reach the brain, they're going to cause central nervous system disturbances. The biggest one we're concerned about is ammonia. Your ammonia should be between 18 and 16, or 18 and 60, and if it's any higher, then it's going to lead to swelling of the brain and central nervous system problems. They start off as subtle changes. Some people will just notice personality problems or changes where maybe, you know what, mom was very reserved and calm and now she just flies off the handle at little things. Or you know what, grandpa really just swears like a sailor when he never cursed in his life. They're going to have issues with memory loss, irritability. They'll have issues with being able to sleep, which will then make them tired and lethargic. As it progresses, they're going to have almost like dementia type symptoms. They'll have confusion. They'll have difficulty walking with stupor. Asterixis is where they're going to have tremors and jerky involuntary movements, especially in their hands. They'll have convulsions and coma as well. Labs that we follow when somebody has liver problems. ALT and AST tells us if we have tissue damage. Alright, if those are, any of these, if they're elevated, then we have a liver problem. The GGTP is going to tell us if there's a problem with bile and a little bit about liver disease. Right, bilirubin tells us if we have obstruction to our bile ducts. Right, and ammonia tells us if we don't have toxins being filtered. Right. Liver cancer usually develops because it's secondary to some other type of cancer. So for instance, they had breast cancer and it metastasized to the liver, or they had colorectal cancer and it metastasized to the liver. Right? Liver cancer as a primary site or primary liver cancer in the U.S. is very rare. We don't see it very often. Like I said, it's usually because it comes from somewhere else. If they do have it as the primary site, they usually were exposed to one of these other risk factors. They were exposed to Aspergillus, which is a particular bacteria that releases mycotoxins that are very toxic to the liver and can mutate DNA. They had some other liver disease that was chronic before, cirrhosis or hepatitis infections like Hep B or Hep C. All right, those have caused chronic inflammation, which had led to cellular changes, which then allows them to mutate and convert over to cancer. Pancreatitis is whenever we have inflammation of the pancreas. What happens is anytime the pancreas is inflamed, it's going to release more enzymes than it's used to, and than it should. The enzymes then cause intense tissue inflammation and damage to the pancreas itself. That leads to more enzymes being released, and we end up in this vicious cycle where we actually have the pancreas auto-digesting itself. Right. Acute pancreatitis comes on suddenly. It's from autodigestion, leads to necrosis and bleeding or hemorrhage of the pancreas. Chronic is usually from scar tissue that has formed in the pancreas and then is now interfering with normal functions. Patients will have things from pain to bleeding whenever they have pancreatitis. So pancreatitis can be caused by excessive alcohol intake, trauma to the abdominal cavity, infections, side effects of certain medications, especially anabolic steroids when they're used inappropriate, thiazide diuretics, GI surgery, anything like belly banding, gastric bypass, tummy tucking, stuff like that. Because anytime you mess with the stomach, alright, the pancreas is right behind it. So they often need to move the pancreas or manipulate it to work on the stomach. Alright, and when they do that, they can cause irritation to the pancreas and it can lead to pancreatitis as a complication. If we have decreased blood flow pancreatic ischemia, then we're going to also have issues. So things like long-term hypotension problems, like with shock, all right, things that last longer than a few minutes, are going to lead to complications with the pancreas as well. So acute pancreatitis, things we see, it comes on suddenly and abruptly. It's from that autodigestion where the pancreatic enzymes get released. They digest the pancreas itself. That causes inflammation, releases more enzymes, and so on through the cycle. It leads to tissue necrosis. That's where it's going to turn black and die, and bleeding or hemorrhage of the pancreatic tissue. Patients will often have very severe epigastric pain. So epi means above, gastric is stomach. So pain right above the stomach area. They're going to have abdominal pain that may also radiate to their back. Their abdomen is going to be distended, and they're going to have hypoactive bowel sounds. Their heart rate will be up. They'll often experience nausea and vomiting with a fever as well. They can have respiratory distress because it's going to hurt to take a deep breath, so they'll have shallow breathing. And they cannot have anything at all by mouth, because anytime somebody puts something in their mouth, if it stimulates them salivating or even starting the digestive process, it's going to release pancreatic enzymes. All right, so if somebody's in acute pancreatitis, we absolutely do not want them having any more enzymes than they already have, because it's going to make things worse. So they can't have anything by mouth. No food, no water, no pills, nothing like that. The labs that we watch when somebody has acute pancreatitis is serum amylase and serum lipase, right? So serum amylase, whenever somebody has pancreatitis, it's going to rise in the first 24 hours, all right, and then it's going to remain elevated for 48 to 72. So when someone first starts with symptoms, we're looking at amylase, right? When somebody is continuing, all right, we're going to then switch over to lipase, because after 3 days, amylase isn't going to be accurate. All right, so lipase elevates a little later, 24 to 48 hours, and then it stays elevated for 5 to 14 days. So as they're getting treated, we will monitor their lipase problem, or their levels. The white blood cells are going to also be elevated as well, so we would see leukocytosis. So this is a normal pancreas. This is what one should look like. This is one that has had acute pancreatitis. So you can see the areas of autodigestion there that went on. They turned black. That's the necrosis, and then all of this darker red, that's the hemorrhage or the bleeding that it caused. Chronic pancreatitis is where they have progressive, over time, damage to the pancreas. This leads to scar tissue. That means that then the scar tissue can't function like normal healthy tissue, and then the organ itself can't function. It's a risk factor for pancreatic cancer to develop. They experience more persistent with reoccurring kind of waves of epigastric pain and left upper quadrant pain. It gets worse if they drink alcohol. ETOH stands for alcohol, or eat a large meal, because those stimulate increases of pancreatic enzymes to release, more so than normal. They'll often experience anorexia with nausea and vomiting, issues with constipation and flatulence, which is passing gas, all right, and they're going to have difficulty on normal function with other disorders, like they're going to develop diabetes mellitus, because you need pancreatic enzymes to break down sugars in food properly. They're going to have malabsorption issues, which would be an exocrine disorder, because since they're not getting their enzymes released like they should, they can't digest their food down to the level that they need to pull out the nutrients for it. Pancreatic cancer is our 4th leading cause of cancer death in the U.S. As people get older, it also increases with age. Men get it a little bit more often than females. It starts off with just some back pain. Patients will also experience weight loss and jaundice over time as they have issues with absorption. Okay. And the problem is that it doesn't respond well to chemo and radiation. We don't have very good treatment at all for pancreatic cancer. So patients who get it, we have about 100% mortality rate. They can try some very extreme surgical procedures, but otherwise we don't really have a good cure for it. So most patients who get pancreatic cancer die from it. So next up is viral hepatitis. These are a group of viruses that cause inflammation and damage to the liver. we have 5 different types. There's A, B, C, D, and E, right? All of them are going to cause inflammation of the liver. All right, they're all caused by different bacteria, different strains. Some are chronic, some are acute. All right, we'll talk about the most common ones as we go through the rest of these slides, but they're all going to cause inflammation of the liver, which then can lead to liver cell necrosis and scarring. They're going to interfere with Kupffer cells. These are the cells in the liver that are in charge of removing bacteria and toxins from the blood, as well as breaking down used up red blood cells or hemoglobin. Right? They're going to have hyperplasia problems. And then they're also going to lead to infiltration of the liver by white blood cells or phagocytes, which then can cause more damage. So the patients who experience hepatitis, they're going to have a widespread inflammation of the liver tissues. So all the lobes, all the tissues are susceptible to damage and swelling. The liver damage then causes the hepatic cells to necrose and die off. It causes overproliferation and enlargement of the Kupffer cells, so then they can't work properly, so they're not going to remove bacteria and toxins or break down our hemoglobin. They're going to interfere with the flow of bile. Alright, so now bile can't get through that circulatory system of the liver. It's going to back up into the gallbladder and cause cholestasis. So chole always means gallbladder, stasis means to stay. So bile is going to just stay there. It's never going to get into the liver and never get into the duodenum of the intestinal tract either. If we stop the insult, alright, so if we get rid of the virus, then the liver can actually heal itself and restore to normal function. But not all the viruses can we get rid of. So that's a problem. Clinical manifestations, it's going to go through 3 stages, and they have to do with jaundice. So remember, the other name for jaundice is icterus. The pre-icterus stage happens about 2 weeks after somebody is exposed to hepatitis. They experience extreme tiredness and fatigue. They don't have a lot of energy reserve, so they're going to get tired very easily. They're going to need to rest periodically throughout the day. They also get nausea, vomiting, diarrhea, anorexia. Their lymph nodes will get enlarged. They could also experience headaches, fever, and joint pain. In the icterus phase, this is when the jaundice sets in. Alright, so all the symptoms that go with jaundice, the color change, the itching, the dark stool or dark urine, clay-colored stools, alright, their fever is usually getting a little better in this phase, and it lasts about 2 to 4 weeks. The post-icterus phase usually lasts much longer, so it's 2 to 4 months. Alright, the jaundice starts to resolve. The malaise and fatigue is still there. They still, because they're fighting off this virus, or don't have a lot of energy and need extra help. Their liver remains enlarged, their appetite may get better, alright, and their pain's going to start to subside. Hepatitis A is one of the more common types of hepatitis. Now this one, we usually just do supportive care if somebody gets it, because they can fight this one off. This is one that's passed through the fecal-oral route, which means fecal matter that's contaminated has to actually make it in the mouth of somebody. Alright, so things like eating contaminated food and water, kids who don't wash their hands, contaminated shellfish, those are all putting people at risk. These are the ones that if you hear restaurants giving people hepatitis, it's usually Hep A. Takes 15 to 45 days. We prevent it by having good hygiene. There is a vaccine available if people are going to be traveling, and people can get IgG or immunoglobulin before or after exposure to try and help them. Hep B you have to get through needle sticks or exposure to mucous membranes from infected blood or bodily fluids. We do have a Hep B vaccine. We really encourage healthcare providers, because they're a high-risk group, to get it. Hep B can also live on surfaces for 7 days or a full week. Hep C is also the same, percutaneous, permucosal exposure to contaminated blood and body fluids. This actually mostly is transmitted through sexual contact, and it's easier to get than HIV and AIDS, and a lot of people don't experience that. It causes chronic infection. Most people who get it only live about 20 years because it's going to lead to cirrhosis and liver cancer. We want to prevent exposure. We don't have a vaccine, all right, and we don't have an immunoglobulin to help these folks either.